Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
an elderly hypertensive with diabetes mellitus and bilateral renal artery stenosis. The management is verapamil. Actually, this enalapril is contraindicated in bilateral renal artery stenosis. That is, ACE inhibitors and ARBs are contraindicated in bilateral renal artery stenosis. Okay, then beta blockers and thiazides are also avoided in diabetes mellitus. So the rest left is verapamil. Drugs that can be used for the treatment of hypertension in diabetic patient is losartan, captopril, and amlodipine can be used. They are safe in diabetics. Whereas thiazide diuretics and beta blockers are mainly avoided. That is, thiazide diuretics and beta blockers are avoided. Next, antihypertensive drugs which are beneficial and have neutral role in lipid metabolism is, so antihypertensive which are beneficial or having neutral role in lipid metabolism will be propranolol and losartan have a beneficial role in neutralizing or neutral role in lipid metabolism. So, prazosin and clonidine. If you see prazosin and clonidine, they will lower the LDL cholesterol and increase the HDL cholesterol. ARBs and ACE inhibitors have no significant effect, whereas propranolol will raise the triglycerides and LDL and HDL cholesterol ratio. Diuretics causes dyslipidemia. Calcium channel blockers have no effect at all. So, this is the important thing.
thank you and thank you for watching.